It's then Paul Werker speaking again about Dupuytren disease in general practitioner care.
Thank you, Anna. Yeah, this is a talk that I'm giving on behalf of Roel van Stralen, who is also one of my PhDs, and he is becoming a GP, and he was specifically interested in Dupuytren disease in the primary care, not in the last place because they are the gatekeepers of the health system in the Netherlands, as they are in many other countries, I believe. And since it seems that the treatment of Dupuytren may be shifting in the future towards less invasive treatments, and we as surgeons may not play a role as big as we have now. So, and we do not know exactly what we are looking at. Yeah, my disclosures you've seen. And so we do not know exactly what's going on in the primary care. So the main aim of this project was to map the trajectory of patients with Dupuytren disease in primary care. And it's actually, this is in the few minutes that I have, I'm going to talk about two papers that Roel published recently. And I think he has been working for more than 2 years on this, so it's not really representing all the effort that he put in. At least it is a registry-based cohort study, and Bente knows all about this because she used the same cohort, which is formed by 58 GPs, I'm sorry, and there are about 500 patients in the registry. And after quality control, there were almost 400,000 patients that Roel could use for his studies. And he was trying to find out things like incidence and prevalence. And unfortunately, not every patient who had Dupuytren was coded using the ICPC code, which is a specific general practitioner code, the L99.03. But luckily, he could also use text mining to find the data that he wanted. There will be descriptive statistics for sex, age, comorbidities, lifestyle factors, also using the same codes. And we will be presenting here the incidence rates as first contact for Dupuytren disease per 1,000 person years for the period of 2017 to 2021, and the point prevalence also. And apart from that, I will be talking about the time and the number of contacts that the patient had and the symptoms and their management. Now here you see the results of the incidence. For males in blue, it was an average about 1.7, and for females it was about 1.4, and you can see that the incidence did not change much between 2017 and 2021, which is not surprising, of course. Although in some countries we see that the number of treatments are increasing, and at least the patients that enter the surgical or the collagenous care are becoming higher. The prevalence is also very similar to what we know from the secondary care. There's a peak at the level of about 70, and most of the patients are between 60 and 90 when they present. In the registry, there were 3,360 patients who had the ICPC code or Dupuytren in the text that were text mined. And during the study period, which ran from 2005 to 2021, 84% of the patients that had that code had visited their GP, and in 93% of cases, the diagnosis was set at the first contact. And 73% were only seen once in the GP practice. You can see that the GPs in general are very well able to set the diagnosis. Now the question, of course, is what happens next? And there you have this very interesting Sankey diagram, and I'm going to try and explain it to you. You can see here a number of symptoms like LAM, curvature, and daily life impairments, and a combination of symptoms that you see here further down. And you see the majority of patients that were in the registry, 52%, were seen with a LAM. And the big majority of them, they were sent away by the GP with a watchful waiting therapy, which is actually quite good. And even some of the patients with a mild contracture, I hope, they were also put into a watchful waiting strategy, but the patient who really had a lump and especially a combination of symptoms, they were referred to the secondary care to be looked at. And you can see that some patients came back to the GP and then were referred further on. So in conclusion, the GP seems to be very able to look at the patient with Dupuytren's disease, and over 50% of the patients with Dupuytren remain within primary care, and of course that's a good figure to realize, and we will be curious what's going to happen next if Charlie comes up with the biomarker and if radiotherapy is going to work. That may really change the position of the GP as the major referral to something else, or the major treater of something else, but a surgical intervention. Thank you very much.
Thank you very much for that. Ilse?
Could that also mean that if 50% stays in primary care, you published earlier that the evolution of nodules is really low, only 15% or so, that it might be even lower because that is done in patients that came to you, so that's not primary care, so maybe it's even lower.
Yeah, I think that many patients that were found to have Dupuytren's in our prevalence study that we did by going from door to door, they did not even go to the GP because they were not aware that they had Dupuytren's. Yeah.
Anyone else?
Okay. Thanks.
No, thank you very much, Paul.